If you don't see it, maybe check your spam. Sometimes it goes into there. And that email will have a link to HR Connection for you to go in, make your benefit elections. If you can't remember your password, don't worry, just click on the link, click Forgot Password. Your username is your email address, and you can reset your password at that time. We are in a little bit of a time crunch because the new benefits go into place on January 1st. So we're looking to have all the elections done by Friday. If you don't do anything, if you don't make any changes or want to keep everything where it is today, you will get the same level of coverage. We'll go ahead and push your benefits forward if you don't go on to HR Connection and make an election. If you do want to make some changes, please feel free to log in and make your benefit elections, and I'm going to go through the process with you right now. First thing I'll say is on the dental and the vision and the life insurance, there are no changes. It's the same insurance company, same rates, exactly the same products you have in place currently. We are having some changes on the medical insurance though. With the current insurance company, we had quite honestly, we had a bad claims year. There were a lot of claims. It was an expensive year for TMD because it is a self-funded plan, so TMD was paying those claims. We did go out and shop it. We found an option that we think is going to be better and help control cost and maybe be a little bit better coverage and employee experience for you as well. So currently you're with a company that has the Cigna network, and we're moving over to the Aetna network. So Aetna is one of the top 3 largest insurance companies in the country. They have all the hospitals in the area, over 90% of the doctors, and then the Aetna network is also national. So you can go anywhere in the country and find participating providers. You need to go to Mayo Clinic or Cleveland or University of Chicago, they're all within the Aetna network. Okay? Just like in years past, you do have 2 different insurance plan options. We have the traditional health plan, and then we have the health savings account qualified health insurance plan. Most of you are probably on the traditional plan because everyone at TMD has this except for one person. But you do have the option to pick between the 2. So if you want to take a look at both plans side by side, you put a check mark and click the word compare, and you get a side-by-side benefit summary of the 2 different options. I'm going to start with the HSA qualified plan. The HSA qualified plan has to meet certain criteria under the IRS guidelines in order for it to qualify for a health savings account. The primary guideline with the HSA plan is that everything goes to your deductible first on this plan. Okay? So whether that be doctor visits, prescription medications, emergency room, hospital stay, surgery, you have a $1,600 deductible that you have to pay first for the year before the insurance pays anything. The only exception to that is preventative care services. So your routine exam, your lab work associated with that exam, mammograms, pap smears, well child care, immunizations, those are all going to be covered 100% with no deductible and no copay under both plans. Okay. Everything else on the HSA plan, you have to meet your deductible first, which is $1,600 per person. Maximum deductible for a family is $3,200. If you satisfy that deductible, the insurance company is going to pay 80%, you're going to pay 20%. But your out-of-pocket maximum on that plan is $4,000 per person. So if your deductible and the 20% that you pay after hits $4,000, then the insurance is going to pay 100% thereafter. Okay? If you go onto the traditional plan, you're going to find there are a lot of services that you don't have to pay your deductible for. You just simply have a copay. That's going to include doctor visits, urgent care, prescription drugs, and we'll go through that line by line here. Also, you'll notice the deductible is lower. It's $1,000 per person, maximum $2,000 per family. Still 80% coverage, and still has a $4,000 out-of-pocket maximum on that plan, $8,000 for a family out-of-pocket max. So if you have a bad year, you have $100,000 worth of medical claims, your responsibility is going to be $4,000, the insurance company is going to pay the other $96,000. Okay? As I mentioned, preventative care services are all covered 100% with no deductible and no copay. Under the traditional plan, if you go into your doctor's office, whether it be your primary care physician or you go see a specialist, it's a $25 copay. There's no deductible, and the insurance company pays 100% beyond that $25 copay. If you have a virtual visit, this is a visit with a doctor through Teladoc, and that can be done on your phone. It can be done on a tablet or a computer. The copay is waived. It's a zero copay, 100% coverage. And these are for things that are simple, like colds or flus, pink eye, things of that nature. You can do a virtual visit with a doctor, and you're going to save that $25 copay. Okay. Plus, it's convenient. You can do it right from your kitchen table. Chiropractic services are covered 100% after a $25 copay, and it's a limit of 30 visits per person per year for chiropractic care. If you do have an inpatient hospital stay or an outpatient surgery, this is where your deductible comes into play. You pay the first $1,000, and then the insurance company is going to pick up 80% until you hit your out-of-pocket maximum, and then they'll pay 100%. If you go to an urgent care facility, there's no deductible. It's a $25 copay. If you go to the emergency room, you do have your deductible and then a $250 copay. If you have outpatient mental health or substance abuse services, it's a $25 copay and then 100% coverage. And then on prescription medications, it's a 3-tier drug program. So tier 1 medications are generics. Those are a $10 copay. Tier 2 are preferred brand names. It's a $40 copay. And tier 3 are non-preferred brand names. That's a $60 copay. Okay? Any questions on that? Okay. So when you're ready to choose your plan, you're either going to select the traditional, the HSA plan, or the waive button. If you do have coverage through your spouse or through the government, like Medicare or Medicaid, TMB will give you an opt-out reimbursement of $166.67 a month, which amounts to $2,000 for a full year. You do need to provide evidence of your other coverage, so you would bring in a coverage or a card from your spouse's insurance or through Medicare or Medicaid if you want to get that opt-out reimbursement. Okay? So let's say you want to pick the traditional plan. You click on the word select. You're then going to choose your level of coverage. You will notice that the single rate on this plan is exactly what it was in the past. So the $25 per pay period did not go up despite a bad claims year. The rate for the employee spouse, employee children, and family did go up slightly. $15 on the employee and spouse and employee and children rate, $20 on the family rate. Okay. If you do pick coverage with a dependent, please make sure you put a check mark next to your dependents' names in order for us to know what dependents you want on your policy. And then you can click elect.